Osteoporosis. Your health and well-being is important to all of us. Today, your healthcare provider has requested that you watch this brief video. Over the next few minutes, you will learn about a specific type of condition called osteoporosis, how it occurs, and what you can do to prevent pain and achieve a healthy spine. Osteoporosis is a disease in which the bones of the body gradually weaken until even a simple fall or bump can cause a break. The most common bones that fracture are the hip, the wrist, and the vertebrae of the spine. Osteoporosis is called a silent disease because you cannot feel or see your bones growing weaker. Loss of bone strength occurs slowly over time, going unnoticed until a simple activity like picking up a grandchild or a bag of groceries or trying to open a stubborn window results in a fractured bone. Most people, in fact, don't even know they have osteoporosis until a bone breaks, and by that time the disease has already advanced. Vertebral or spinal fractures can cause back pain or tiredness, loss of more than 1 inch of height, a stooped, rounded shoulder appearance, or the formation of a hump in the upper back. It is not unusual for osteoporosis sufferers to fracture vertebrae and not even realize it. Half of women and 1 in 5 men over age 65 are at risk to sustain fractures due to osteoporosis. Since osteoporosis is a disease of the bones, it is important to understand how bones grow and change. Contrary to popular belief, bone is not a lifeless structure. It is a living, growing tissue. The bones of our skeleton are made of an outer shell of dense bone that surrounds a honeycomb-like inner structure of trabecular or cancellous bone. Bone is actually a protein framework that hardens as calcium and phosphorus are deposited onto it. It is the minerals calcium and phosphorus that make bones strong, so without enough of those minerals, bones are weaker than normal. As we age, our bones are constantly being rebuilt, as old bone is removed and new bone is laid down. That process is called bone remodeling, and it consists of 2 distinct stages. The first stage is bone breakdown, or resorption, followed by the second stage, or bone formation, where new bone fills in the spaces where bone was removed. A number of factors affect bone remodeling, such as hormone levels, the amount of calcium in the body, and the amount of regular exercise a person gets. As you can see so far, osteoporosis is a complex disease. With osteoporosis, either too much old bone is removed or too little new bone is reformed, or both these processes can occur in combination. This net result is an ongoing loss of the amount and strength of bone. Not all osteoporosis causes are known, but certain risk factors are believed to contribute to a person's likelihood of developing the disease. Many, though not all people who develop osteoporosis have several of these known risk factors. Osteoporosis risk factors you cannot change. Gender. Women are more likely to develop osteoporosis than men because they have lighter, thinner bones and lose bone mass rapidly after menopause. Age. Although all of us lose some bone tissue as we age, the amount and rate of loss varies widely in different individuals. Heredity. Young women whose mothers and fathers have had fractures tend to have lower bone mass. Body size. Small-boned, thin women and men are at more risk than larger, big-boned persons, but bigger bone size is no guarantee that you will not get osteoporosis. Ethnicity. Caucasians and Asians are at higher risk of developing osteoporosis than African Americans. However, anyone may be at risk. Low bone density is a serious risk factor for developing osteoporosis. Fortunately, it is one of the risk factors you can lessen by making healthy lifestyle choices. Osteoporosis risk factors you can change. Hormone levels. Early menopause, whether it occurs naturally or is surgically induced, increases a woman's likelihood of developing osteoporosis. Diet. Inadequate calcium and vitamin D intake is harmful to bone health. Excessive consumption of other nutrients, such as protein and sodium, can decrease calcium absorption. Exercise. Individuals who are inactive, immobilized, or bedridden for a long time are at high risk for osteoporosis. Lifestyle choices. Smoking and excess alcohol consumption affect bone remodeling. Women who smoke often have lower estrogen levels than non-smokers and can experience early menopause. A diagnosis of osteoporosis begins with a thorough medical history, including questions about any history of osteoporosis and fractures you or family members may have experienced. Your doctor will evaluate you for signs or symptoms of possible fractures and may order specific tests, including X-rays, if a fracture is suspected. One of the most important tests in the diagnosis process is the measurement of bone density. Bone density measurement is a painless procedure referred to as BMD testing, which stands for bone mineral density testing. Several different machines can be used to measure density of bone in various parts of your body. Once tested, the density of your bones is compared with the optimal bone density of healthy young adults. The results of BMD tests fall into one of three categories: normal bone mass, low bone mass, and osteoporosis. The lower your bone mineral density, the greater the risk of your suffering fractures. Based upon your BMD tests, your doctor will discuss what steps you should take to maintain or improve your bone health. Above all else, follow your healthcare provider's instructions for healing and prevention. This may include special nutritional recommendations, as well as exercise prescription. Be sure to take the right kind of calcium with other supportive minerals and vitamins to allow for the best absorption into your bones. All nutritional supplements are not created equal. Ask your doctor about which nutritional supplements will gain better results in helping your bones get stronger. Your healthcare team has a star player, you. With you leading the way towards a better state of health, it is important to keep all appointments, follow your treatment plan for longer-lasting results, exercise as instructed, eat properly, and follow stretching and ergonomic recommendations. Working together as a team, you and your healthcare provider can decrease the likelihood of future problems, prevent degeneration, relapses, or flare-ups, and avoid chronic pain syndrome. A better quality of life is the wellness goal to better health. With proper osteoporosis nutrition, care, and prevention, you're on the right path to achieving that goal. If you have additional questions about the information presented, please ask your healthcare provider for assistance.